I'm Dr. Vikram Huded, Director, Intervention Neurology, Narayana Group. Brain stroke or paralysis or Parshvayu or Lakwa is second leading cause of death in the world. According to World Stroke Organization, 1 in 4 people will have stroke in their lifetime. Good news is it is a treatable condition and a preventable condition. You should know there are 2 types of stroke. One is ischemic stroke, which happens because of the blockage to the blood flow to the brain, and it produces symptoms. You can remember the mnemonic B fast. B for balance, if there is a problem in the balance. E for eye problem, either blurred vision or double vision. F for facial asymmetry, face becomes one side. A for arm weakness, one arm will go down. S for speech disturbance, and T for time to rush to stroke ready hospital. If there is a ischemic stroke, we can give clot buster injection if you come within 4.5 hours time. Or if there is a large clot, we can remove the clot by using clot retriever, which is called mechanical thrombectomy. And in some cases, we can do this procedure up to 24 hours time. Coming to second type of stroke, which is hemorrhagic stroke, is caused because of the high blood pressure. So there is bursting of blood vessel inside the brain. So it is called hemorrhagic stroke or brain hemorrhage. So in one type of brain hemorrhage, which is called brain aneurysm, the brain aneurysm, which is like a ballooning of the blood vessel, it can rupture and produce bleeding inside the brain. So if we find out before only if there is a balloon-like swelling inside the blood vessels in the brain, we can prevent the brain hemorrhage. So if you see anyone having brain stroke, so you need to rush the patient to brain stroke ready hospital. Because in stroke ready hospital, all the processes is done faster. We do investigation fast. We do CT scan or MRI faster. And if there is a clot, we give clot buster injection. Or if there is a bigger clot, we remove the clot using mechanical thrombectomy. So that's why every second when the blood flow to the brain is blocked, we lose 32,000 neurons. So the earlier we do the procedure, the chances of improving is better. Stroke, the risk factors are high blood pressure, diabetes, high cholesterol, smoking, obesity, sedentary lifestyle, and obstructive sleep apnea. Some patients who have cardiac conditions also can come with ischemic stroke. So it is important that we should control these risk factors. So we need to control the blood pressure, we need to control diabetes, we need to control cholesterol, we should stop smoking, we should stop consuming alcohol, we should take healthy vegetables and fruits, and we should do regular physical activity. So if a person develops stroke, some patients can have minor symptoms. So means they can have weakness for some time, for few minutes, and it improves. It is called minor stroke or TIA. So minor stroke and TIA means it's an emergency, but usually people neglect. They don't come to the hospital because it has improved. They will attribute these symptoms to various reasons. It may be because of abnormal sleeping, or so you should not neglect these minor stroke symptoms. So out of 100 patients, only 25 will have minor stroke. It is a warning symptom. If you have a minor symptom or if you are having a TIA, if you come to a neurologist, we can evaluate to see whether there is any blockage to the blood flow to the brain. If there is a blockage, we can give medications, or we can do angioplasty, stenting, or surgery, and we can prevent a bigger stroke.